From January the 5th, travellers arriving in the UK from China will have to prove a negative COVID test before flying. Now, the move by Prime Minister Rishi Sunak comes after similar moves were made by the US, France and India after months of lockdowns. China is due to open its borders again on the 8th of January. Health Secretary Steve Barclay said that the UK was taking a balanced and precautionary approach, describing the measures as temporary, whilst officials assess the latest COVID-19 data. So, to discuss the merits of these measures, I'm joined by Professor Angus Dalgleish, Professor of Oncology at St George's Hospital School in London. Thank you very much for joining us. Right, so do you think the government are doing the right thing?
Yes, I do. I'd like to point out that from a medical point of view, there's probably not a great need to do this initially. But I think there's a lot more than the medical aspects to this. I think there's the overriding thing here, I think, is political. China basically covered up everything about this. They covered up the very instance, the very existence. They covered up the source of the virus when it's clear to many of us that it had come from the laboratory. And they let it escape, basically, out of China. When the WHO had previously said there's no way it could get out of China if there's a pandemic, everything would be in place to prevent it. And none of that came true. And I just feel we've been punished for 3 years by basically the carelessness and lies. And I don't think we should allow them to get away with it. So I think having some kind of restriction here, it sends a political message. You can't just say, we're opening up now, we're going to let our 2.5 million infected people out and they can go and infect you all again. I think there has to be, you cannot get away with that. So that's why I actually support them having the testing. And then there's a couple of knock-on effects of this, is that if it's true, well, it's reported it's true, that over half one of the planes from China, that everybody, half of them were infected with COVID, then it is likely in this population that's been sort of locked down, poor health, not been able to exercise, and all these other things, that they're going to get ill eventually. And can we really afford to have any more demands on our health service when you can't get into hospital even if you're dying? So to have unnecessary...
It's not funny, but it is, isn't it?
These cases is the point. And then there's another knock-on point, which I do think needs to be borne in mind, is that there are several studies now showing that people who have had booster vaccines are more likely to get other infections. It makes them more susceptible to other viruses. So that's another reason why I really don't want another group of people infected coming into the country at the present time. And bear in mind, too, that even though you have a negative COVID test when you get on the plane, there's many, many cases where people have been negative getting onto the plane and positive getting off. So we are going to have this excess exposure.
Well, I mean, it's a good point. I mean, the NHS can't exactly cope with even us, so forget anybody else. And there is the case of things like long COVID, which have shown to be quite a drain on the health services because people are ill, and also a drain on the work environment because people aren't going to work. I mean, but they've said that the strain is Omicron, which is one that we've had here before. But we can be reinfected. Can we be reinfected with Omicron, or is it being reinfected with different variants of COVID that is actually happening?
Well, we hear of people who've been infected with COVID 2 or 3 times, and they've had it, and they're probably different strains. Certainly, the Omicron was much more infectious, but much less of a problem medically. It wasn't going to send you to hospital, or you weren't going to die from it unless you had lots of other underlying conditions. And so it is likely that the other variants that we'll be exposed to will be even less dangerous, but they will be infectious. And, these viruses compete. COVID competes with flu, it competes with the common cold, and we've got an awful lot of people now, and I was one of them recently, who had a really bad cold because I hadn't been exposed to it for 2 or 3 years because the COVID outcompeted it, and colleagues have had very bad flu. So I think the actual COVID will be the so-called new Omicrons that we might get exposed to in the future will probably be the least of our worries. The flu and the cold seem to be more serious with regards to causing illness.
Is it just because we are now searching for different variants of this disease or this virus that we're now saying, oh, there's this variant and that variant? I mean, is it not almost like the common cold where there are lots of different types of it, and if we were to start testing for the variants of the common cold, we would find the same thing?
Oh, you'd find many, many variants of the common cold. I mean, they're not all. Common cold isn't always caused by the same type of virus, let alone the same strain or variant. So, yeah, I don't believe that we should be listening to Sage and these other people, what I call these doom monsters, who are basically always looking for the very worst scenario. And now we know that in the modelling, which caused the first lockdown, they only presented what was the very first worst scenario, and therefore the one that was probably the least likely, on which the ministers and everybody acted and locked us all down and caused this incredible chaos and economic collapse that we're experiencing. So I do think everything needs to be brought into perspective. And my number one reason for supporting them for China is China cannot just decide she's going to let everybody out of her country and come here and infect us without us having some regulation. If she'd done her job properly in Wuhan when the virus first escaped and infected the people, I mean, she lied about everything. They said for ages, don't worry, it does not travel from human to human. It can only come from the back to human, so it does not spread. When it was obvious to anybody who's there that it was being spread just like the flu, coughs and colds, etc. But the people were going down. It was very bad. And they lied to us. Had they admitted, and they're not corrupted the WHO, which is, I think, was the real Achilles heel. The WHO, if it had been free to operate like it did in SARS and MERS, it would never have escaped. And the whole thing would have been locked down and contained. But the WHO severely chastised China over the way they handled this. So instead of China taking note and actually being a good citizen, as it were, when the next one came up and doing what it's told, it had corrupted the WHO by lobbying for a non-medical, a very suppliant head, which is Tedros G, I call him. And he basically listened to them and did not alert the world when he should have, and it should never have come out of China. And China cannot just walk away and not be held to account for this. And it's one of the reasons why I think you have to instill, say, come into our country, you're going to have a test first.
Well, Angus, thank you very much for that. But very briefly, though, really quickly, because we've got about 10 seconds, do you think that this is a man-made virus, or like a virus that's been boosted, or do you think that it was something that it was natural, that it escaped from an animal?
Oh, when the backbone of the virus came from a bat, there's no doubt about it. But the bats were living over 1,000 miles away, and they were brought to the laboratory for research, and they had lots of viruses on. And it's well known that they isolated lots of bat coronaviruses from these things, and they had about 600 at least. And then they were engineering them to make them more infectious to human cells.
Oh, right. So they messed around a bit.
Do that, it's eventually going to escape. I mean,
Angus, listen, we've got to go, but thank you for that.
Possible.
Angus, thank you for that. We're going to have a long chat about this at some point. Well, I'll take you for coffee, Angus, sometime. It's Angus Dalgleish. He's just all about COVID. Well, let's speak to my panel, Danny, Christine and Lizzie. Right, I'm going to start with you, Lizzie, right here. What do you think about that? I mean, I say reparations, frankly. I want reparations from China about this.
If China just suddenly want to open up, I just think we should let them in.
No.
I don't want to get another variant. I don't want to have another lockdown and all that panic. And look what it did to our economy and the mental health, what it did to schooling. We've got a real mental health epidemic from COVID.
It's only Omicron. I mean, it's only Omicron, Christine. Apparently we've had that before.
Well, it was so refreshing listening to an expert and to be able to agree with everything he said. I thought he was absolutely brilliant. Yes, of course we should. And I'll tell you what we should do. We should test them all. And because of what the professor said about they get on the plane without it and they get off it with, test them when they get on and test them when they get off and make them pay for the test. There's no reason why we should pay for these tests. Either the Chinese government should pay for them or the individual traveller. And I agree, testing may not have any real effect, etc., etc., but that's not the point. It's the principle. They have behaved so disgracefully I don't believe a word of what the Chinese say, so let's make them pay.
What about quarantine, though? Maybe they should be quarantined and then they can come in. They can pay for the hotels.
Put them in where the asylum seekers are.
The asylum seekers
No,
are taking up
all the
those,
hotels. There's no
those
room.
beds.
There's no room left.
No room.
I think the professor is overstating the significance, the political significance, because President Xi, there's 1.4 billion people in China, and he's had them under more or less house arrest for the last 3 years with his COVID-0 policy. So the professor thinks this is punitive. President Xi doesn't give a damn about a few thousand Chinese having their COVID swabs. He doesn't care about that. That's just irrelevant to him. Everything else, I sort of agreed with him. But why the Chinese public are being punished? They've been under lock and key for 3 years with this crazy COVID-0 policy, and now when the world opens up to them, we're punishing them personally.
Well,
Yeah, but we can't.
It's a little test. We're
It's not
asking
at all.
you to
What is wrong
It's
with
a
having a
little
test to make
swab.
sure that you haven't got a virus?
You should apply that to everybody,
Have
then.
you called an ambulance recently?
But we can't-
Have you tried to go to Q&A&E?
Yeah.
There are
Because
31
what you need to
ambulances.
consider is that, fair enough, but if our health service will become inundated, it'd be worse than it already
Yeah,
is.
and you know, at New Year, 31 ambulances outside a hospital with dying patients not being able to get seen.
We
cannot do this. We really can't. And I'm sorry, China are responsible. And I'm sorry.
Yes, it's Omicron.
So
We can't-
It's Omicron. It's
They
not
may have different
that's
strains and variants. We don't
Ah,
know.
well, no, that's speculation.
know, but we
Christine
don't
says.
know.
Christine.
Well, we can't afford a single foreigner having to take advantage of our NHS. We simply can't, for reasons that have been stated, because we haven't got enough for ourselves. So if there's any chance of keeping anybody out who might have COVID and end up in intensive care, let's try.
Or maybe they should have some, if they are going to come, there should be proper health insurance, by which they'd have to pay. But then the point is there's nobody who can actually take care of these people, because we can't even take care of people in this country.
I agree.
Omicron isn't as deadly.
It's not the fault. It's not the fault of the individual Chinese. Of course it's not. But we can't get to President Xi.
He doesn't
Yeah.
give a damn.
How do you know he
It's-
doesn't give a damn? That's
Because the professor said he doesn't give a damn about what the World
That's
Health
no
Organization
reason.
said.
But I'm-
Organisation
no
said.
reason.
I
Not
give a
to
damn
do it.
about our people, though, and our country, and our NHS is on its knees. We can't
That's right,
afford.
it is.
OK, and we really can't. And it's going to be the responsibility of the airlines now to do all the checking on all of that. That's as well.
Well,
That's why I think the
I'd like to
travellers
see
should pay.
reparations. I want reparations, frankly, for this COVID thing.
I'm going with Christine. Stop all foreigners coming in.
No, that's not. No.
Not quite what I said.
No,
Not quite what I
Christine did
said.
not say that.
I know she
No, hold
didn't.
on. No, but let me just clarify
We
what Christine's saying.
cannot afford any foreigners coming to use our NHS because we haven't got enough capacity
What,
for
even
ourselves.
if they
That's
pay?
what I said.
Exactly.
What if they pay?
Oh, if they pay, that's, well...
Everything
they
the
wouldn't be
professor
used-
said, I totally agree with.
Yeah.
And I think it's fantastic.
Well, look, to be honest, I mean, look, from my view, in my perspective, I just think that actually this virus came from China. They lied about how bad it was and, that it couldn't pass from human to human and things like that. As a result, travel wasn't suspended in the way it was, although America did do that. I don't know how much difference it would have made, but the bottom line is I think that we should be asking China for reparations.
Exactly.
Because it's cost us all a fortune. We ended up buying PPE from China to make up, and they were the only ones that had anything left.
Yes.
And so in the end, they profited heavily from this virus.
They have a lot to be
And apparently
responsible for. I'm angry at China for
It's all
it
apparently
still.
piled up.
I really am. We're still trying to recover. We're still in this lockdown crisis with everything that's going on.
Good luck
Well, all the
trying to get a few quid
PPEs.
off President Xi. You ain't got a chance.
We'll send you in.
Yes.
Send it to heavies.
Danny will
To
do
heavies.
I look like a Buddha. You may recognise me.